Alrighty, ladies and gentlemen, good evening. It is currently July 1st, 2026, and today I'm going to be covering strep throat, which is also known as streptococcal pharyngitis. The disease itself is actually caused by group A streptococcus, also known as GAS bacteria. Nationwide, GAS causes about 5.2 million outpatient visits a year in the United States, and it's actually responsible for 20 to 30% of children's sore throats, and also along with 5 to 15% of adults, according to the CDC. And actually can lead to a more serious invasive form called IGAS, and unfortunately for the United States as a whole, it has nearly doubled nationally, and it rose from 3.6 to 8.2 cases per 100,000 people between 2013 and 2022. And it even, like, as I said, it's hit the United States, but in Pennsylvania, where we are, of course, we have got hit very hard as well. Pennsylvania reports that there was a 300 to 400% increase in strep throat visits in fall of 2023 versus the year before, according to NBC News. And invasive GAS actually remains a monitored reportable condition statewide, according to the Pennsylvania Department of Health. In terms of normal transmission, it spreads horizontally, if you would say. It spreads person through to person via respiratory droplets and direct contact with oral secretions, like sharing drinks or utensils or anything like that. Main story is if you're having like a coffee or like a beer, mate, and you feel kind of sick, just don't share your drinks. It might work out a bit better for you. Um, this is actually different from vertical transmission, which would pass disease down from mother to child during pregnancy or birth. It's not an STD. You can't pass it on to your kids. If a sick person has it, they're going to pass it on to you, not mother to baby. You can't get it in the womb. It's not hereditary. That's very simple. Sick person infects you, boom, you're sick. All right. Now, you may be wondering, how does your immune function respond when it comes to a strep throat infection? First of all, the innate immune system will kick in, and you'll see symptoms such as inflammation because the neutrophils are really being jacked up. And that will cause that classic sore throat feeling, increased fever, you're also known as hyperthermia, and swollen lymph nodes, which of course you'll feel upon palpation when you palpate the neck and the head, all that stuff, right? Then the adaptive immune system will kick in, and that produces antibodies against the bacteria and protein. And you can actually get strep throat repeatedly. In rare cases, the antibodies actually cross react with the heart or kidney tissue. And it's actually called molecular mimicry, which causes complications like rheumatic fever in children if the infection isn't fully treated, which of course opens a whole nother can of worms. At risk populations, children ages 5 to 15 carry the highest burden of uncomplicated strep throat. And for invasive disease, the highest risk group are adults, the geriatric population, which is, of course, those between 65 and older. And unfortunately, it can also infect people that experience homelessness, people who are IV drug users, long term care residents, and indigenous populations, according to Medical Daily, which produced an article in 2026 relaying the minority populations that have a higher chance of getting strep throat. Reportability of the disease, it's not really individually reportable. However, invasive GAS is reportable in Pennsylvania through the PANEDSS system, and streptococcal toxic shock syndrome is way more reportable. It is actually nationally notifiable through the CDC. So, overall, in short, strep throat is very common around here, and usually the symptoms are pretty mild. However, it can cause real damage if untreated, and it actually can carry real risks for vulnerable populations. and it requires vigilant treatment and strict adherence to antibiotics. And then, in severe cases, primary prevention skills and public health reporting. That's it. Thank you. Hope you all have a great night. Thank you.